Hello, I'm Dr. Suvarchala, Scientific Director with ZIVA Fertility Centers. Today we'll try to understand the hormones which are playing an important role in a female reproductive system. What is responsible for the egg to ovulate? What is responsible for all the activity which is happening inside the uterus, the endometrial layer, where the embryo is finally going to implant and the baby is going to develop. So let's try to understand all the combinations and the duration, the frequency of release of these hormones. So before we understand that, we'll see the small little portion inside the brain called the hypothalamus, which is very important and critical in the release of the subsequent hormones which are released. So hypothalamus releases the GnRH, which acts on the pituitary. Now this is another very small gland, and the pituitary is responsible for the release of FSH and LH. So even if you don't pay attention to the other things, just remember FSH and LH. FSH is follicle stimulating hormone and LH is luteinizing hormone. These two are very important when it comes to the egg development and release. So FSH directly acts on the ovaries. Ovaries are where the eggs are growing, and FSH acts directly on the ovaries. To understand how it works, we need to understand how the ovary is first. Now, all the eggs that a woman is having during her entire menstrual period, like since she's born until she reaches menopause, are pre-decided, or she's already having those ovaries when she's inside her mother's womb. So with millions of eggs she's born, and every month a few are becoming atretic, that is they degenerate, they die. And once she hits menstrual cycles, that when she is in her early teens and she starts her menstrual cycles, which is periods, one is released every month and a few perish in that cycle itself, they die in that cycle itself. So this cycle keeps happening month after month until she reaches menopause. But a very critical thing is that from around 30-35, this also might become a little far and few in between. The ovulation also might be affected as the age also advances, depending on the ovarian reserve. How many eggs are left inside the ovary is also a very critical factor in deciding how many are being released. Now, so like I said, the FSH acts on the ovaries, and let's look at each cycle. So FSH acts on the ovaries, and a cohort, a group of eggs are selected, and out of these only one has the capacity to become very big. Now during the first few days of the release of FSH, all these 10 to 20 are beginning to grow. It's like there are some kids and all are given equal amount of food, and the opportunity is similar. So similar to that, all the eggs begin to grow. But what happens is, with rising FSH, there is an increase in estradiol. This is a very critical hormone again. This estradiol, as it rises, gives a negative feedback to the pituitary that FSH is reaching to a maximum now, you need to bring it down. So FSH comes down and there is an increased release in LH. Now remember, luteinizing hormone is what it stands for, I told you. Now estrogen has increased, given a negative feedback that please don't release too much FSH, and there is an increase in LH. Now this increase in LH also causes an increase in the size of the follicle, but its most critical function is the release of the egg. So if the LH hormone is not proper at this time, there will be failure of this growing egg to release. Now which egg is released? How is it decided? Now out of all these 20 eggs which are growing, once the FSH levels are reduced, the egg which is the strongest, you can say the egg which can catch the FSH signals the strongest, is the one which keeps growing, and the others die around it. With the increase in LH level, that egg then releases and comes and waits in the tubes for sperms to reach it. In all this, there is another very important hormone which then takes care of post-fertilization. Alright, the egg is released. Alright, the egg has been fertilized by the sperm. But then what about the endometrium? What about the uterus? Is something taking care of it as well? So once the egg is released, there is a hormone called progesterone which is released. This is a very critical hormone for the endometrium, for the uterus. This make sure that the blood flow into the endometrium is at its maximum. This blood flow is like nutrition to the embryo, and that's what helps in the implantation, as in the embryo then attaches itself to the outer layer of the uterus, the endometrium, and then digs deep in and forms a baby. So that's what is very critical, and you need to understand all this. Once the egg has fertilized, then progesterone takes over. It makes sure that the blood supply is maintained and the baby grows. If the egg is not fertilized, the embryo doesn't reach the endometrium, the uterus understands that there is no pregnancy and the progesterone level comes down, the egg degenerates, and there is a bleeding of the endometrium. So the endometrium then begins to shed off as a period, as a menstrual cycle. So this is basically what is happening inside the body every month. And if the periods are regular, then the woman can also track the time the egg is ovulating from the ovaries. If her periods are not regular, then there is a mismatch in the release of follicle stimulating hormone, release of luteinizing hormone. There is an imbalance between estradiol, estrogen and progesterone, which is why maybe she is failing to get pregnant. So if we were to study and analyze the levels of follicle stimulating hormone and luteinizing hormone, estrogen and progesterone in a woman's cycle, we can get a fair picture of what's going wrong inside and what needs to be added or to be looked at for the woman to get pregnant on her own. If we were to look at the cycle, if we were to look at time from day 1 of the period to around 26 to 32 days. Now, why are we talking about such a big window, 26 to 32 days? So, a normal menstrual cycle, a period which comes from 26 days, anywhere from 26 days to 32 days is considered normal. So, if you were to fall into this bracket, 26 to 32 days, it means that the cycles are fairly regular. So, remember what is a infertile time. When the periods are going on from day 1 to day 4 is when it is a highly infertile period, isn't it? The egg is ovulated and there was no fertilization. The endometrium then prepared itself. The implantation did not happen because there was no fertilized egg and an embryo, and it began to shed. So the period began to happen, and that's when there is nothing happening, and so the fertility potential of the entire system is very low from day 1 to day 4. From day 6 to day 5, again day 7, again it depends on the cycle duration of the woman. That's when the next cycle is being prepared. The egg for the next cycle is increasing in size and developing. From day 8 to day 19, remember, if it is a regular cycle of 26 to 32 days, from day 8 to day 19 are your fertile days. These are the days when the egg is growing at its best potential and it releases and has a potential to get fertilized inside the tubes. From day 20 to day 26 again is an infertile window. Remember that the egg ovulated during this fertile period, waited for the sperms to reach it, for it to fertilize. If nothing happened during that period, the egg is degenerated. Then the endometrium begins to realize that there is no embryo coming down, having a good supply of blood. The embryo did not reach, so it begins to get ready to shed itself. So from 20 to 26 day, it is called the luteal phase or the secretory phase, when it begins to secrete, and that is most infertile. So this is kind of in brief what's happening inside a regular cycles a woman having a regular cycles, and when is she fertile, when is she not fertile. So the window to get pregnant and plan pregnancy is very small, is about 10 days, 10 to 11 days, and that's when you are at the best potential to get pregnant. If you have more questions, if you want to understand based on your cycles, your duration, your length of cycles, what is the best time for you to get pregnant, please take an appointment, call the number on the screen and take an appointment and come down. Thank you.